Thank you for joining us today. On behalf of the Brigham Board of Trustees, I'm here to share our immense gratitude and pride in the hardworking and dedicated employees of the Brigham for your extraordinary response to COVID-19 pandemic. During this unprecedented period of great uncertainty, you have served as a community with compassion and resilience. I am filled with awe, admiration, and gratitude to each of you for the personal sacrifices and individual contribution you've made to confront the COVID-19 crisis. Let's take a look back.
Some breaking news now. We're following the coronavirus outbreak. A new case in the United States. It's in Massachusetts. It's that state's first. That makes 8 confirmed cases in the United States. The federal government on Friday declaring a public health emergency.
I'd never landed on an intensive care unit where every patient had the same diagnosis. We don't usually have every patient on the unit all ventilated at the same time. You constantly hear the sounds of ventilators. That sound is still playing in my head.
Do the lungs sound diminished? Do I hear wheezing? Do I have an IV starter kit? Do I have a blood pressure cuff? Do I have everything I need in case things could go south?
You see some despondent faces, and then all of a sudden it's just you put on your game face and you go to work and you do the job that you need to do.
When we realized that this was going to be real, that it was going to be big, that it was going to command all of the resources and effort and creativity and intellect and logistical management that we could muster, I think we all paused then and looked up the side of the mountain and felt the enormity of it.
I remember coming together in January when the first threat of COVID was emerging on a global scale, and we started pulling a group together to say, what would we need to do to prepare in the event that this ever became a reality?
We certainly didn't know how long or how vast the experience would be. What we all did know was that it was going to be hard. It was going to be challenging.
This is here. It is real. It's going to be a crisis. We don't know where it's headed, but we absolutely need to be prepared for the unknown.
I remember back in February seeing in some of the media from around the world reports of asymptomatic individuals being capable of transmitting the infection. Well, the moment you say that a person can be asymptomatic with this infection and contagious, that's a game changer.
There was a pandemic around a respiratory viral pathogen. There was also a pandemic of fear. How is the virus spread? Would I be at risk if a patient coughed near me? Will we have enough PPE? What will happen to my family if I get sick? I think there was a whole nother pandemic around that.
The specific event and the specific disease was different from anything we had ever planned for. And so there's definitely anxiety that goes along with that.
What would we do if we didn't have enough ventilators to go around for all of our patients? What would we do if we didn't have enough ICU beds? Why was it that our disadvantaged patients were more likely to get COVID-19? Why was it that they were more likely to die? And what could we do to prevent that from happening?
I remember spending a lot of time saying, do we have a plan to care for those first 3 patients, 15 patients, 40 patients, 220 patients?
Could we make sure that the care that we were delivering, the research that we were doing, was equitably spread to all of our patients?
And then we built that model.
We redeployed a lot of our OR, a lot of our PACU, a lot of our procedural staff to the ICU environment. That was very challenging.
It was a different environment. We were all in a different building. We were on a different unit. Everything possible was different.
I was absolutely terrified. We don't really fully understand everything about COVID. It's something completely new, and the unknown scares everyone. It scares me.
The first patient I encountered in full PPE, through a mask, through a face shield, layers of plastic, it struck me that this patient was also wearing a mask and looked terrified.
Some of the reassurance that I can provide people is just the fact that I'll be there with them.
To be the sole clinician at the bedside when a patient was dying was powerful for them, and they wanted to be there fully for their patients, and they were and they are.
I remember seeing some of the nurses who were incredible on the Red team, some of our patients who were right there at the end of life, just sort of petting their heads and saying sweet things to them, and it was one of the most touching moments I ever experienced.
There are many very sad moments of patients dying. There are many happy moments when we were able to discharge a patient, and everything in between. Operation Hope was to really recognize and celebrate every COVID-positive patient discharged successfully from the Brigham, to give them hope, but in addition, to give hope to our providers and our staff and our environmental workers and food service workers. We are discharging patients and they are going home, and there will be life after COVID.
I was in awe of my colleagues for their willingness to care for patients, no matter what the risk might be. It's what we're called to do.
It's about the people, and it's about the support that people give each other. And it's about the dedication, the commitment, and the caring, and that's what it's all about.
I want to be able to look back and say that we gave it our all, that we came together to do our part to bring the epidemic under control. And the good news is I think that's true. We've done that.
So what's important to me is that we take the lessons we've learned from COVID-19 and the gains that we've made for equity and advancing equity, and that we don't lose the ground that we've gained. It is too critical, too important. And as an institution, I am sure that all of us now, today, are more committed than ever.
At the end of the day, when we walked out, I wanted to feel like we had done our job. And that job was different every day. It had to do with staffing and equipment and supplies, but at its core, it had to do with taking care of our community. If we do our job really well in a pandemic, a lot of what we do is invisible to the public. All of the caring professions have had to work together for so long to do things so differently than we usually do them. It was absolutely breathtaking.
Thank you.
This has been an extraordinary period in the Brigham's history. As we just look back at our response during the peak of our crisis, we now take a moment to pause, reflect, and honor the work all of you did to help us get through the worst of this crisis. This COVID-19 pandemic changed life as we knew it, presenting us with challenges we have never seen or experienced in our lifetimes. And yet you, the caregivers and staff members of our Brigham family, rose to the occasion with courage and commitment. You drew on the attributes that define our great community: compassion, leadership, collaboration, innovation, and action, to face this challenge head on and respond in truly inspiring ways. As your hospital president, I want you to know that I have never been prouder of all of our 22,000 Brigham employees for coming together, standing tall, and epitomizing the Brigham way.
In true Brigham spirit, you were flexible and adaptable as we changed virtually everything we did. We established incident command, and we converted the hospital to be able to care for a very large number of COVID patients. We created a daily attestation process to get everyone safely in the door, and we increased the need for frequent deep cleaning and decontamination. We redeployed our staff to new teams, new places, new jobs, new roles, and we even shifted to working from home. We stood up telemedicine in a big way to be able to continue to take care of our patients. And every one of you, every day, did your jobs and did them so well because you knew that lives depended on it.
In the true Brigham spirit, where we provide the highest level of care, you ensured our environment was safe for our patients and for each other. You comforted our patients during a time when we weren't able to have visitors at their bedside, and we weren't able to have their family at their bedside. You became their family. You comforted them. You held their hands. You provided the care and the compassion that you are so well known for.
In true Brigham spirit, you worked tirelessly to solve for shortages of the personal protective equipment we needed to protect our frontline staff, acquiring and accepting donations of new supplies, while also working to produce some of that equipment in-house. You made the safety and well-being of our staff a top priority, working to provide a wide range of resources and basic needs, including food, transportation, parking, temporary housing, childcare coverage, and mental and emotional support services.
In true Brigham spirit, you took steps to address social inequities and partner with vulnerable members of our neighboring communities to help detect and prevent infections. You mobilized community-based testing in neighborhoods that experienced high rates of infection and performed screenings for social determinants of health. You distributed food and care kits, multilingual information packets, and promoted access to care, regardless of insurance or immigration status.
In true Brigham spirit, you worked around the clock to innovate. You solved for the shortage of test kits, and you developed them in-house to develop new protocols. You set up multiple pop-up testing sites that allowed testing of thousands of patients to happen in safe outdoor units that protected all inside the hospital from exposure. You led clinical trials that tested the potential of existing drugs to treat COVID-19. And as we entered the stabilization stage of this crisis, you recognized that our work to confront COVID-19 is still just beginning.
Today, many of you continue to explore new treatment options and a better understanding of the role of antibody testing, even as we accelerate development of a vaccine that we know will help us save and restore even more lives.
It's been an extraordinary team effort, and the compassion, commitment, and can-do attitude of everyone involved has been truly inspiring. When we look back on this time, we will remember the courage and the resiliency of our staff, the strength of our patients and their families, and the outpouring of support from our community. While so much in the world has changed, the Brigham's mission and strengths as an institution remain solid and strong. Together, we are wholly committed to caring and pioneering breakthroughs that will lead to a healthier world.
And this has never been more critical or meaningful than it is now. This is the moment that future historians will study and remember the critical acts of leadership, heroism, and healing that made all the difference in fighting COVID-19. Those acts took place at the Brigham and continue today, and we couldn't be any prouder.
Hey everybody, this is Massachusetts Governor Charlie Baker. And I've always been incredibly proud to be part of this great state. And I want to say to everybody at Brigham and Women's how much you have stood out among your peers over the course of the past several months. This has been a trying time for everybody, but the one thing I know for sure is the folks at Brigham and Women's are doing everything they can to make sure that they deliver for their patients and for their Commonwealth every single day. Time and time again, for many years, you've proven that you can stand up and do it. And boy, oh boy, I had a ringside seat to watch you all perform over the course of the past several months. It's been an honor and a pleasure to have a chance to see so many wonderful people perform so far above and beyond the call of duty for the better part of the past few months. And I have no doubt as we look forward and assume that COVID's going to be with us for a while, that you will continue to outperform anybody's expectations. Thank you for what you do, and thanks for making Massachusetts that very special place.
Hi everyone, I'm Maura Healy, your Attorney General. I can't say thank you enough to all the doctors, nurses, medical and hospital staff at Brigham and Women's Hospital, who have at great risk worked tirelessly during this pandemic. I am incredibly proud of and humbled by the courage and selflessness you've shown. I also want to thank Brigham for all they do to examine social determinants of health and to mitigate health inequities in our community. Because when it comes to healthcare, America looks to Massachusetts to lead. And that's why it's so important that our health institutions, like Brigham, are doing all they can to ensure that everyone, regardless of their race, gender, zip code, have a chance to live a healthy life. On behalf of everyone in our Commonwealth, thank you for taking care of our communities, neighbors, friends, and our loved ones. Your service will never be forgotten.
Hi, this is Mayor Marty Walsh. From the bottom of my heart, I want to say thank you to all the employees of the Brigham and Women's Hospital and Brigham and Women's Faulkner Hospital for being on the front lines of this public health crisis. Staff members from every area of the hospital have stepped up in remarkable ways. You have all had important roles to play and have shown what it means to be part of a team. Many of you are working hard and working multiple shifts to make sure Brigham has the support they need. Before this pandemic started, you were doing critical and life-saving work, and that hasn't slowed down one bit. Brigham has long been an important partner to the City of Boston, and that partnership has only grown and strengthened in these past few months. You've helped us provide free COVID testing and resources like food, medicine, and multilingual information packets to our communities and neighborhoods most impacted by the virus. You've helped make sure we're looking out for our residents, especially those in need of extra help during this time. Brigham is one of the world's best hospitals, and that is a large part because of you. So again, on behalf of the City of Boston, I want to say thank you. The city will always remember your service and your dedication, and we will always be grateful.
This is Deuces Wise here with the New England Patriots. Just wanted to say thank you to Brigham and Women's Hospital. Thank you guys for doing your job, and thank you for keeping our community safe.
Hey y'all, David Andrews here with the New England Patriots. Just want to give a shout out and a big thank you to all the doctors, nurses, and staff at Brigham and Women's. You guys are the real champions. Thank you for keeping our community safe during all this time of crisis. We appreciate y'all and hope you know it was not unnoticed. Thank y'all.
The Brigham is a team of champions. You're all true champions at the Brigham.
Hi, I'm Matthew Slater of the New England Patriots. I'd like to take a second to say thank you to the many men and women at Brigham and Women's Hospital who have selflessly served our community over the last several months. I'd like to say thank you to the nurses, the doctors, the technicians, the cafeteria workers, and countless others for your continued commitment to our community and the people within the New England area. Over the last several months, we've all been through quite a bit, but it's because of your selfless sacrifice and continued effort day in and day out that we can have hope that we'll pull through this time. Thank you again for everything you've done, and God bless you as you continue to serve.
Hi, I'm Deb Bonapani, emergency room nurse at Brigham and Women's Hospital. I am a COVID-19 survivor, and I certainly didn't ever think that I would ever be a COVID-19 patient. When I became a COVID-19 patient, It was around April 7th that night, and I said to my husband, "You need to get out of the room because something is wrong with me." And by the 4th day, the chest pain was so severe, my daughter called and said, "Mom, I don't like the way you're breathing." And the next thing I know, an ambulance was at the door. So I went to a local hospital, and that night, I said to myself, I'm absolutely going to die. I asked to be transferred to Brigham and Women's Hospital, and I just knew I would feel more comfortable being in my home, which was Brigham and Women's. My mom kept telling me, you're going to be okay. And I kept saying to her, I really don't know. I had so much to live for. I felt like I was going to make it when the doctor from the research team came into my room and said to me, "Today's the day I'm going to offer you the trial of remdesivir." That's when I knew. The day I was being discharged, I did not know what was going on outside the hospital. And the music was loud, and I'm in a wheelchair, and I have a sheet over me and a mask on my face, and all these people were around. And by the time I got outside, the clapping was louder and the cheering was louder. So I just took my hands and I just threw them up in the air, and I was so happy, for one, to be leaving, and for two, to know that I actually survived something that many didn't. But it was an honor to be so welcomed. You realize that life is very precious. I would like to say to my colleagues, thank you. Thank you for treating me exactly the way I would have treated you.
We are grateful to each and every one of you for the work you do to protect and heal the Brigham community, our city, our nation, and the world. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
We're stronger together.
We're grateful together.